to the 20th Geneva Conference on Person-Centered Medicine, Self-Care and Well-Being in the Times of COVID-19. Art and literature as a therapy for healing and health. Art, literature, and medicine have been intertwined since time immemorial. Intersections point have included drawing to understand anatomy, narrative to deepen the experience of health and illness, and art as an instrument for relaxations, therapy, and health promotions. These activities have led to the establishment of a number of relevant programs, institutions, and professions. New collaborations between art, literature, and medicine are emerging around the concepts of health. This opens enormous opportunity to deal effectively with acute epidemic situations such as stress and violence by using art in a medical, public health, and education science to broadly advance health, well-being, and quality of life for all, and by making medicine more human, more of a humanistic practices as it once was. This is especially important considering the worldwide COVID-19 pandemic, which we are still in the middle of, has technology and demographic to measures forces that moving humankind, take away quality of life and creating environmental, social, and economical problems, all of which often lead to psychological problems, all of which erodes mental health. And then the worldwide COVID-19 pandemic hits, which erodes our system and people's mental health even further. Concurrently, requirement levels of modern society lead to increased stress negatively, affectively equality of life. We have building ourselves into work machines, creating an exhausting society. These characteristics has made society change its life habits towards an attitude governed by a current piece of persistence, stress. Technology pushed ahead with great speed and constant innovations, and these distinctive features in the professional spheres cause individuals to undergo continuous training to keep up to date in the constantly changing society. And COVID made this worse. This demanding way of life has created a radical increase in stress level among professionals, students, and patients receiving medical treatment. Therefore, it is necessary to modernize the process system, education, and training simply adapting to current needs in order to ensure quality of life in diverse society environments. One of the recommended ways to improve mental health is a comprehensive approach to increasing creative development through literature and all forms of art. Mental health must lead to an optimal quality of life in the face of the disease piece of our time. Creative activities have been shown to help relax, and change the stress we accumulate so we can face with greater confidence and dynamism new demands that are asked of each of us in an important and competitive world. If it is important to complete. Professionally, it is equally has been a focus on respect toward oneself and others, to work or to study in a warm settings in full harmony with colleagues and classmates. Certainly, it's the best road to enjoying good mental health. Experts in the field of medicine, health, and public policy have come together to create new models of education. Training in a health and medicine focus on human values and improving the quality of life. To achieve this goal, alternative programs focus on creative skills, such as reading and painting, and proposing to reduce stress and enhance social skills and give great value to creative and socializations. In conclusion, the development of creative activities has been demonstrated to improve mental well-health by channeling accumulated stress into the creative activities, relaxing and increase confidence. So, stressful situations, including medical crises or conditions, can be faced with greater confidence and dynamism. With that in mind, we must develop programs a part of professionals' medical training that educate and force through sessions and literature and the arts to will enrich lives by using a humanistic approach, including art and culture in their healing practice. So we have an urgent need to propose a new educational model with future mentors who can prepare healthy and productive people to face the challenge of new social, health, and medical change. To live, to work, study, or recuperate in a culturally enriched warm settings in full harmony with peers, colleagues, classmates, nurses, therapists, doctors. Certainly in the best road to enjoying good mental health. Have a safe week.